Alrighty, good morning everybody. The vets are going to be taking a look at Shekinah, Horatio, and Dasher this morning. So we are going to go and take a look at that. Just a little further, buddy. There you go. Getting all the treats.
This handsome boy is Shekinah's glory. He's been at Horse Plus since summer, and he is hopefully going to get to go to his forever home soon. So he's been really healthy since he's been with us, but he's potentially being transported to another state. And so Dr. Gina and Nicole and I are just going to do a full workup today. I examined his teeth. I don't have his record in front of me, maybe in June. And he didn't need any dental work done. But before we send him, we're just going to do some full blood work, put the speculum on and examine his teeth again, palpate, make sure everything looks normal, and just kind of do a thorough workup. He just got a little bit of a sedate today. It's been very cold and muddy here, and he's a dirty boy, so we're probably going to brush him off. But we don't have any major health concerns today. We're just looking to make sure we're not missing anything. The only thing that we've documented on his medical record, he has a little bit of a scar on his cornea over here. He had that when he came in. You can see he just has a little bit of blue scarring right there. He probably had a corneal ulcer, and then the body heals that ulcer by sending new little baby blood vessels in. It's called neovascularization, and then over time, if those vessels aren't needed, they can kind of recede, and then you end up with just a little hazy scar, but he can see fine, and we're not concerned about that. It's been stable since he got here. So that's what we're doing. Sir, your gut sounds are totally normal. Open up. He's like, no, thank you. He's like, I've been on an extended vacation where no one's ridden me, so don't really want to do it. All right, inevitably, I shine this light directly in everybody's eyeballs, so I'm going to try really hard not to do that. Beautiful teeth, sir. Okay, I'm going to palpate. Why did I feed this horse so many cookies? Just palpating for any sharp points, mobility. It's pretty much perfect. That side. I'm gonna have to rinse. I'm gonna have to rinse this other side. If you're Haley, you like to just stand right where the water comes out. Your teeth are just perfect, sir. Oh, what a good boy. A little bit of tartar buildup. I'm just making sure that this little tartar buildup up here at the top of his teeth isn't irritating his gums and they look totally normal and not. I know, I'm putting your dental tartar down in your bottom lip. It's very insulting. Good boy. He's got a little bit of tartar buildup. Thank you. I'm just gonna snap off so it doesn't become a problem. Okay. Absolutely no concerns. Gums look great. I'm gonna rinse his mouth out one more time. Good boy. Okay.
bathe your nostrils. You good boy. You good boy. Yeah. Yeah, there you go. Good job.
Uneventful, but happily uneventful dental exam.
Good fat layer.
Yeah.
La, la, la.
I know the physical exam form is like integument, and it's like dirty winter. Okay, I know, you hate that. Oh, you hate it so much.
You have fat in your sheet.
And I didn't get any poop. Would you rather have my whole hand up there, sir? Like, I feel a ball of poo. Just let me have it. I'm getting a fresh fecal sample. We're gonna do a fecal egg count on Shekinah. We don't have indications that GI parasitism is a problem, but horses can have low levels of parasites that are normal, and we don't wanna unnecessarily deworm them, so we're gonna get a fresh fecal sample and set it up and just make sure he doesn't have an unexpectedly high parasite count or something we weren't expecting. So we'll just make sure before transport that he's ready to go.
So we pulled some blood and did a CBC Chem complete blood count and a chemistry panel on him. His complete blood count, which is like the red blood cells, white blood cells, his hemo concentration, all that kind of stuff, was relatively normal for his age. The chemistry, his GGT, which is a marker for liver function, is almost twice elevated than what it should be. The upper range is 24 and his was 47. He also has some elevations. They're still within the normal range, but they're high normals, which is abnormal in an older horse. His albumin, total proteins, and globulins are all a little elevated on the high normal side. So that could be inflammation. So if something is insulting his liver, that would make sense. Usually GGT by itself is more like cholestasis as opposed to like liver injury, neoplasia kind of thing. So we're thinking about just putting him on some supplements to help combat that a little bit before he goes to his forever home.
Oh, what a good boy. Oh, we're still in time.
So before moving on to like Horatio and Dasher, they're gonna go around breaking the ice in the water troughs because Haley's not here yet, and we're just gonna go ahead and break up the ice. Get Horatio, Dasher, and Donnelly's pasture.
It's gonna take a minute.
There you go, guys. This is how cold it's been in Tennessee for the past couple days. There you go. Hi, Dino. Let me get this for you guys. And just push this out.
If somebody just holds this on this side, maybe if I think I can drag it from that side. Yeah, do that. Yeah.
There you go.
Where's Cowboy?
Behind.
Oh, hey, Cowboy.
Okay, so now they're going to bring in Horatio, and it looks like Vince is filming for the members video. So if you're a member, you'll be able to see that later. But they're going to bring him in for an exam now in the vet barn. we go.
Good boy. Perfect.
Good job, buddy.
Give him a minute right here.
This is Horatio. We have him in this morning to do a dental check on him and just kind of work him up a little bit fuller. He is very lame. He's got digital pulses in his feet, so I think he probably needs to live in shoes. But his conformation is he's very cowhocked in the back, which means his tarsal joints face in and his toes face out. So that is a conformational problem that we can't really fix, that will need physical therapy, I think, for the rest of his life to keep him comfortable. When we palpated him last week, he was really reactive to his stifles, like almost offering to kick because he was telling us, ouch, that hurts. And with the forces, when your legs are like this, it's constantly putting torque and extra stress, chronic stress that's not supposed to be in that angle on those joints. So I think his stifles, even though he's only 11, are really, really painful just because of the change in his conformation since he's had it since birth. So we're going to try and give him the NexHA injections like we gave some of the other horses. It's off-label for certain joints, but it's just an IV injection once a week for 3 weeks is what the study shows. No, you're fine. And if we can't really keep him comfortable, I'm a little worried that he's already just going to be a pasture pet. It's too painful to ride him, but hopefully we can make him more comfortable. And if we can't, then we need to talk about his quality of life. But we're starting at square one right now, so.
You just have some little points.
That's all I saw on radiographs, but he wasn't really still, so
Yeah.
his jaws were kind of all over the place.
Yeah, he really doesn't need a lot of work.
Yeah, so why haven't you gained more weight than you have, sir? Because he's been on weight replacer.
Yeah. I think he has gained a fair amount.
Some.
We shall see. There we go. Oh, so much better. Little sharp spot. Nicole, can you hold the tongue out this side for me? Yeah, he's got another little teeny tiny point on the lower left arcade that needs to be reduced. But like literally, I need his tongue out this side if possible, and I need like seriously 1 tiny second. So his teeth were really not a big problem. He definitely needed a dental, but far from the worst mouth we've seen. That's important. It does look like he busted an abscess on the lateral side of this foot, but it looks old, like months old.
Yeah, we didn't notice anything like that on the day of, but I think he still had, I don't remember if he had shoes or not.
Yeah, you smell super threshy.
I'm sure all the horses have thrush right now.
Yeah. So I don't know if you heard us talking earlier, we were talking about cardiac. You can see how when an arterial pulse comes up the neck, so arteries carry blood from the heart to the rest of the body. The carotid artery runs right up here in this jugular groove, and doesn't necessarily mean something significant, but see how you can see every pulse in his neck really, really clearly? Sometimes that does become more pronounced under sedation, and he was sedated to have his teeth done, but it also can be evidence of cardiac disease, so we just want to take note of it. Again, if you're watching this and you see it on your horse, doesn't mean your horse has end-stage cardiac disease. It can be a normal finding, especially with sedation, but we don't always see that, and so it's something I always take note of. The NexHA instructions say to do a full surgical clip and prep ahead of time. So we're gonna scrub this very, very well before we give that injection. The jugular vein lays right on top of the carotid artery, and when you hold it off and you see this filling, it's because the blood coming from the head going back to the heart. I'm occluding the ability of that blood to go back to the heart for a minute. I can't really occlude arterial flow from here. And he picked his head up, and so you can still see a little bit of that pulse, but it's much less noticeable than it was earlier when he had his head really relaxed and down.
Yeah, if it extends into the middle or cranial 1/3 of his neck, then that's more suspicious of a cardiac problem. But when you're listening, I don't know if Dr. Lee already said this, when you're listening and you're watching, if it's asynchronous, that also means you have something cardiac going on too. They should be the same, like lub-dub, and you should see it correspond with what you're hearing. And if it doesn't, then you need to investigate. Nothing is out of normal range, but his total proteins and globulins are high normal.
Okay.
You bet, I'm right next to you.
Okay. So Nicole, let's do this one, and then let's try again. Yeah, perfect. Put the plate right there. Let's try again. If we don't get what we want with the plate on the ground. Yeah, we're gonna have to put the plate on the ground. It's annoying. Sorry. Yeah. It's got some arthritis up here.
Yeah, I think I noted that last time, but I couldn't get a
So
straight
let's
lateral.
do DP. Yeah.
It was kind of oblique, so I'm like, it could be arthritis or it could be the angle that I'm getting. So I wasn't sure.
Yeah, he's not straight. His medial to lateral balance is super off.
Yeah. His conformation isn't fabulous, poor guy.
You're such a good boy. You're trying so hard. Can I have it, please? Come on. Good boy. Oh, good boy. Okay. Yeah, I guess his toe is just long. It's just a weird, it's just like pancaked out.
Yeah.
He
doesn't have a lot of soul at all.
Yeah.
So he's going to have to live in shoes.
Yeah.
Unless somebody can get him to grow soul.
Yeah.
So could that be why he is?
That could definitely,
Could be contributing for sure.
but before his shoes were removed, he was still painful in the hind.
Yeah.
Yeah.
So.
Why is it so weirdly obliqued?
It's the way he stands. I was having trouble getting.
Yeah,
started
man,
videos.
what a weird foot. Okay, let's try one more time. Nicole, you're great. I'm gonna change my approach a little bit. You're great. You are not the problem. Yeah, it really is just that flat.
Yeah, he's got a very.
Yeah, that's okay. I don't think we need to like super much fight it. I think that first view.
The only hard part is going to get his stifles.
You know about the pokes, don't you? You're a good boy. I just gave some butorphanol. There are 2 different concentrations. There's some for small animals and there's some for large animals. This is a large animal kind. It's an opiate type sedative pain relief drug. And what we were discussing is that before, Nicole and Dr. Gina took radiographs of this horse without any sedation, and he was a really good boy except for his stifles, which is kind of the equivalent of the human knee. It's the highest range of motion, kind of most complicated joint in the equine pelvic limb, and it's higher up on the body, and he was very bad boy, trying to kick, didn't want anybody to mess with it. So I'm using butorphanol to see if it was a pain response, that we think those joints were painful, or if he just doesn't want to be touched back there. He's been a really good boy generally. It's not perfect, right? Like it's not a perfect rule out, but this is a horse, if you watch the footage of him walking in, he's very like, his level of comfort is not great just at baseline. So adding extra pain meds certainly isn't going to be a problem. And we've got a heated recovery stall, so we're going to keep him inside until he's all the way fully awake from this. So we're just going to give that a minute to kick in and make sure that he's very, very comfortable, and also so that we can learn as much as we possibly can from these diagnostics. If we think we see something radiographically that might be soft tissue, we'll want to clip that joint so we can get a better ultrasound. So I'm not really sure what we're going to find with this guy. Thus far, I don't really see an answer for the level of discomfort that we're seeing with him. He's got really pancakey feet. He had an abscess for sure on the left front. We do think he would benefit from shoes, but he is very uncomfortable somewhere, and we don't really have that like, yep, that's why. And if we're lucky, it's just some major soft tissue issue that happened in the trailer on the way here. That's not as likely as that he had some horrible career-ending injury before he even ended up on a slaughter buyer's truck, and then he fell in the trailer. So we're going to give it everything we can because we really want to save this horse, but we're not going to do that at the cost of asking him to be uncomfortable every day. So we already talked about the NexHA. Dr. Gina is going to do a sterile injection of a different treatment modality that hopefully will help target arthritis wherever that is. But we're going to take some stifle radiographs first.
Does the sedation help?
I didn't notice any response, but he's got a lot of pain meds on board, so. You're such a good boy. If only it were safe to just stay on opiates all the time. Yeah. This is the most comfortable I've seen this horse since he got here.
Yeah. Opiates are good for pain management.
Yeah. I'm always kind of secretly hoping for a like, oh,
Yeah. Fix it.
there it went.
Yeah.
Nick.
But I mean,
Not so much. All right, let's just see how he is about touching back here. So that was a good, like, I just touched his penis, and he was like, over my dead body. Okay.
that's what he was doing when we were even approaching his stifles.
Yeah.
After I like thumbed through them and felt like all the tendons and things, and
Yeah.
then after that he's like, nope, don't
Yeah.
touch me. And I was like, okay.
But good example, right? Like if
Yeah.
his reactivity was just to his stifle, he would have done that to his stifle. Okay, I'm not going to touch your penis again. Let's see how this goes right here. Oh, that's a good boy. What a good boy. Very nice. All right. I think we can get stifle rads. If you guys are cool with it, I'll hold the plate because I would rather get hurt. Go ahead.
Right there?
Yep. Just try it, it's fine.
I don't know if I'm gonna get anything in there.
Yeah. Yep, nothing. That's okay. Let's try for the other one. I'm sorry, I don't think I got the plate high enough up.
Yeah.
I don't know that I can, with the way his legs are, if I go up higher, I think I'm gonna touch him.
Yeah.
I think you're right about SI. Like, he wasn't reactive up there. Everything about the way he walks in his conformation makes me think that he's got SI pain. So I think the
You could
plan
have
of
both. I was thinking Dasher has SI and he has stifles, maybe SI too,
Oh.
because of the
yeah,
chronic stress and torque
yeah.
from his limbs not being a proper weight
Yeah,
in space.
He doesn't have palpable SI pain.
Yeah.
I think the NexHA is a great idea. I would love to put him on SID Butte for 5 days and like reassess next week. But I would want to see him completely off the Butte
Right.
before saying this is a horse we could adopt out. A horse that needs annual injections feels doable. A horse that needs daily medication and injections feels like what are the chances he's actually going to get what he needs? So
Yeah.
you're being a real good boy. You're being a real good boy.
This is NexHA. It's the non-name brand version of the IV that we can give for hyaluronic acid for joint injection kind of things. It goes systemically instead of right into the joint. It's the same thing we gave like Cherokee, Lenore. I think we were going to give it to Winston. I don't know if we ever got to.
I think we did. He had one injection.
So you give it sterilely, and then you watch them for 24 hours. All the papers and research that have gone into this product hasn't shown any side effects in any of the horses that got it. It's only labeled for certain joints, not all the joints, so using it the way we're using it for other joints is off-label, but we want to give it a shot to see
He
if we
probably
can
has
keep
some
it comfortable.
problems in the joints it's on label for.
Probably so.
You're such a good boy. Okay, I just buttered him up a little bit. Good boy, I know. He's so good. Good boy.
Well, that was a big swallow.
Sorry.
No, you're fine. Trying to make sure I put it in the right spot.
I know. Easy. Easy. Good boy. That was wonderful. What a good boy. Almost done. Oh, good boy. Good job. See, that was not the worst. Okay, we're going to look at your heart now. So this is Mr. Horatio, who's, I'm guessing the name that he might know is Sailor because it's in his registered name. But anyway, we just finished working him up today. He had some blood work run. We took radiographs of his feet. We palpated his back and his stifles. We took radiographs of his stifles. We listened to his heart and lungs and GI sounds, and we floated his teeth. He had some points in his teeth that weren't super severe, but he should be more comfortable. The ulcers in his mouth that he had on presentation are improving. And we were going to do a cardiac ultrasound on him, but we had to reinstall our app, and then our password didn't work, so we had to contact the company. So we will reschedule him for that. That's why he has a little clip spot right by his heart. But he is finished, and he's plenty awake enough to go out. So we're going to take him back out with his buddies, and as soon as we have our ultrasound functional, again, we will schedule him for that diagnostic. Dr. Gina gave him an injection to help combat arthritis. He needs a series of those, so we'll space them out by about a week, right? And he's going to be on non-steroidal anti-inflammatory every day for at least the next 5 days, and then we're going to try to taper him off of that and see how he does comfort level wise. So we'll keep you posted. He was a very good boy. Still pretty footsore, huh? But wow, a lot better than you were walking in here. That's not food. Let's go. Good boy. Very good boy. You're a good boy. Sorry about your bald patches. This is Dasher. He is late teens. He is a branded standard bred. And he came in through our buyout program last month. He just came out of quarantine earlier this week. And he's very off in his hind end. Dr. Gina and Nicole looked at him earlier this week. You're a very good boy. He is reactive over palpation of his withers, but we suspect that he's got pain right up here in his sacroiliac joint. He is pretty reactive on palpation of that area. And then when you watch him move, he's a really good boy. He tries really hard to do what you want, but you can tell that his hind end is not cooperating with what he wants to do. He's got a stellar personality, and he's very easy to catch, and he's a great age to be a pasture companion. But our goal today is to make sure that we can make sure that he's comfortable. We don't want any animal to just go and and not be comfortable. So we're going to take a closer look at him today. He needs his teeth floated. So we're going to put the dental speculum on him and take a close look at his teeth. And then we're going to try to further pinpoint musculoskeletal issues. And then Dr. Gina, the plan is that Dr. Gina is also going to give him a NexHA. Yes, a NexHA IV infusion today as well. We've already done that with one of our patients today. So that's just kind of a general osteoarthritis support medication, and they usually need a couple. So we're hoping that we can get him a lot more comfortable with that and that he can be listed as adaptable. I know, you need some more cookies. You're a good boy. You totally know about needles. Okay. You standies, you've been stabbed a lot. He doesn't look neuro.
No. He just looks real funky. Like when you took him off on a straight end, he went out like this the first few steps.
Yeah.
And I was like, ugh.
Let's start with the left carpus. Oh, you had to move. All right. Let's try, I think we're going to have to shoot like a VD. If you'll hold the plate right in front, I'm going to shoot from the back part of the knee. Let me just touch him a little bit and see if he's reactive at all. I don't get the reactivity vibe, but you never know. Hey, buddy. You snoozing? Good boy. Good boy. Okay, not reactive. Awesome. Dude, you've got great joints. Okay. A little bit of joint collapse in that one. Okay, so I'm gonna have to save these and swap over. Move a tiny bit further, Coddle. Yes, perfect. Why were you so reactive right there? Let's take one a little bit further back, kind of like where this, yeah.
And then there's a lot of like, but that looks like the top of the scapula.
What's this? What's that right there?
That's what I was looking at. I was trying to see. So that should be the dorsal border of the scapula.
Of the scapula. It looks pretty irregular. Look how irregular that is.
Yeah, it's kind of like la 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 la.
Mm-hmm. Look what a good boy you opened right up for that. Oh, what a good boy. Somebody took care of this horse. Those two there. Just absolutely perfect. You're such a good boy. You got one tiny point right there. Wow. There's very little work that needs to be done. I need the tongue out that side of the mouth. Just make sure. Feels good. Beautiful. You're such a good boy. Those are some fantastic teeth. He's so polite. He's like, I don't want to bite it. Good boy. My focal distance was off, but the only thing I see here, he's got some roughening right up here. And he's got some roughening down here. So this is where, if you're not quite sure, you can look at the origin and insertion points, which I literally like open my anatomy textbook and stare at it to tell. Mm-hmm. You can't see anything soft tissue, but see how fuzzy this looks? Yeah. Sometimes the fusion looks a little fuzzier. Apparently, the standardbred industry stabs horses a lot.
Do they?
I mean, so many of the standees we have know what needles are and do not like being poked. Dasher wins the Best Boy of the Day award today. He was so good. We just finished up with all of his things. He got his NexHA injection from Dr. Gina. So hopefully that helps him be more comfortable. I don't think he's going to be sound for riding, but he's just an absolute love. He and Horatio both. I really hope that we can find somebody who wants a super sweet pasture buddy. So we have to see how well the NexHA improves his level of comfort. He and Horatio are both going to be on a new non-steroidal drug, furocoxib, for the next 5 days or so. And then they'll get another NexHA injection, and then we'll wean them off of those NSAIDs, and we'll see if they're at least comfortable enough to be happy in a pasture. So fingers crossed that that happens. He's still pretty groggy from his dental. His teeth were great. His teeth and his level of arthritis in most of his major joints for his age are really phenomenally way better than I thought. So we still do think it's in that sacroiliac joint that he's got discomfort, and hopefully that NexHA will reach that area and improve things for him. So Dasher is completely blind in this right eye. We have a lot of eye cases that we talk about here at Horse Plus. In Dasher's case, this eye is not causing him any discomfort. He doesn't have any extra tearing. He doesn't have entropion where those lids are curling and rubbing. And it looks to me like whatever caused him to go blind happened years and years and years ago. So if he was 3 years old, I might say, hey, let's be on the safe side and take that eye out. We might still, especially if we have an adopter that wants it taken out, do that surgery, but he's so comfortable, there's really no reason why he needs that eye to be removed. It's not bothering him at all, and I don't anticipate that it's going to cause any problems for the whole rest of his life. He can see totally fine out of the left eye. We can speculate over what happened to his right eye. He's got a hypermature cataract on the lens over there. So cataract surgery can restore vision, but he also has a lot of scarring in his iris, and his whole anterior chamber has collapsed and his cornea is scarred. So who knows what happened? He could have had an injury. He could have had a really bad ulcer that ruptured in that eye. But whatever the etiology, he can't see now, and his eye doesn't hurt him at all. So that's really an easy thing to just say, just leave it be. Oh, that's a very good boy.
So Horatio had received a lot of pain medication, and he had also received an NexHA that's supposed to help with joint lubrication instead of going into the joint itself. So we were keeping a close eye on him. The weather had warmed up a little bit, and we were hoping that he might be more comfortable after all these interventions. But looking at him, he was just kind of standing in one place, and he was camped under, so he had all of his legs more underneath his body instead of squared up. And he had his head and neck extended, and anytime we asked him to take steps, if he saw us, he would just kind of be like, ugh, ugh. So even with all these interventions, he was still incredibly painful. We weren't able to control it without having to give him like opiates, which is really unfair for him and for a potential adopter to have to manage his pain with that level, especially with controlled drugs like an opiate. So management and the vet team discussed him, and they elected unanimously that last act of kindness was the best thing, because he was telling us, even though we were trying to help him, that everything we were doing, he was still painful. So not the outcome we were hoping for him, being such a young boy, but he was telling us that he was really, really painful no matter what we were doing. So we wanted to do what was best for him, quality of life-wise.